Glad you could join us today.
Hi, I'm beauty expert Cheryl Kramer-Kay, and I am so excited to tell you about the skincare treatment I just tried called Skin Pen. I had been wanting to try microneedling, which is a treatment for acne scars and anti-aging. Bellis has conducted more than 90 validation tests on their Skin Pen, and it is the first microneedling system cleared by the FDA. That means it is a safe and effective treatment for facial acne scars for patients ages 22 and up. I also learned that the Skin Pen is the only microneedling device made in the US, but it's available in more than 35 countries and has been safely used on more than 10,000 customers. That's what I needed to hear to finally try microneedling, and I'm so glad I did. So most treatments take 30 minutes and there's little to no downtime. I just looked a little flushed after the appointment, but I was able to go right back to work, and by the next day I looked totally back to normal with a gorgeous glow to my skin that hasn't gone away. Hi, I'm beauty expert Cheryl Kramer-Kay, and I am so excited to tell you about the skincare treatment I just tried called Skin Pen. I had been wanting to try microneedling, which is a treatment for acne scars and anti-aging. Bellis has conducted more than 90 validation tests on their Skin Pen, and it is the first microneedling system cleared by the FDA. That means it is a safe and effective treatment for facial acne scars.
Okay, sorry guys, we're working on all the technical difficulties. We're a little new to the Zoom meetings as a group setting like this, but I'm Melanie, a nurse practitioner here at Empire Eye and Laser Center, and I'm excited to tell you more about one of our newest treatments that we've started offering in the last few years. Microneedling is a really unique treatment. The device is basically inducing new collagen production by creating these injuries in the skin to stimulate the body to heal and repair itself. So in the device, as you kind of saw the device the way it looks on the video, there are needles at the tip of it that oscillate in and out. And as we rub that over the skin, those needles are creating thousands of micro injuries to the skin, which these micro injuries are stimulating the body to heal and repair itself. What it's great for is anti-aging, as you saw in the video too, a nice pick-me-up, a nice fresh glow. It is also specifically cleared for acne scars. So this before and after picture we have left up on the screen here, I think is a great indication or a great illustration of the before and afters for acne scars that you can see what it can do. It's designed to help with texture on the skin as well. So if we've got pore size, fine lines and wrinkles, you can see an improvement with that. And it's one of my favorite treatments we offer simply because it has such a low amount of downtime. You'd be red immediately after the treatment for the rest of that day. Really by the next day, the redness is gone. Your skin might look a little bit blotchy, so not fabulous yet, but over the next week you would start to notice that improvement showing in the skin and nice glow that you start to get after microneedling. In terms of the photo on the screen, we can see that she's had a lot of improvement in acne scars. So I will preface this by saying one treatment is great. You would get a nice fresh glow. If we're trying to target texture, like acne scars, we would want to do a series of treatments. So this is actually after only 2 treatments, which I think is fabulous. And the results are cumulative. So 1 treatment is great, 2 is better, 3 is even better. And I would tell a patient who's specifically trying to target acne scars, 3 to 5 treatments would be my best recommendation to begin with. And also when we do microneedling, it's a great way to incorporate PRP. PRP is a little bit of a buzzword, or the vampire facial people are very familiar with. What we do is in the appointment, you come in, we draw blood from your arm and we spin it in a centrifuge. And when it spins, the heavy red blood cells sink to the bottom of the tube and the platelet-rich plasma sits on top, so we can draw off the plasma itself without putting a bunch of red blood cells on your face. That looks really scary. And what we can do is when we rub that PRP on the skin, we have the opportunity to drive it into the skin. So when we put something topically on our face, it's really just sitting on top of the skin, on top of that stratum corneum. When we microneedle over it, those needles drive deep into the tissue, anything that we've now placed on the skin. So we can use it as a delivery system to get that healing and that repair response from deep within the tissue. PRP, the platelet-rich plasma, again, inside our own bodies has growth factors and stem cells that are unique to our own systems. They help to heal and repair broken down proteins and collagen in the skin. So that's where PRP is really going to help enhance the treatment results for, whether we're treating acne scars or really just that fresh face glow. The injuries alone from microneedling is a beautiful result, but when we add PRP, it is more cost to the treatment, but it is definitely an impact in terms of more significant results. We also have other opportunities of things that we can drive into the skin with the needles. So Botox or Dysport is another one that works really well to help with rosacea and pore size. We know what it does when it goes into the muscle. We talked about that on Monday, and we see a relaxation in the muscle. But when we're just putting it into those more superficial tissue layers on the skin, we do see a result in the pore size and the rosacea on the skin for patients who have a lot of redness. I would also like to mention that, when we talk about our post-procedure protocol, we will kind of customize things to the patient. We might make different recommendations on what we would recommend you put on your skin. While those channels are open, we still have an opportunity to continue putting something into the skin, getting those results deep in the tissue layer. So our Zeo skincare line, I know you also hopefully heard about that yesterday. If you're not familiar with it, please watch our videos. And on the Dysport filler, everything we've talked about has now been uploaded to Facebook, or will be soon. But look at the Zeo line because it's really fabulous and really amazing. And one of their most upgraded, newest procedure add-ons they have available is what we can use after the microneedling. It's called their accelerated serums. There's two of them. One is called the firming serum. The firming serum is a fabulous product that gets deep into that tissue layer, helps with lifting and tightening in a way that I've never seen a topical product from any other skincare line do. And now we have the opportunity to take a concentrated version of that and drive it into the tissues with the microneedling, putting it on afterwards. We also have Rosatrol Accelerated, which again is a concentrated version of the Rosatrol serum that we already sell. Perfect for a rosacea patient that's experiencing rosacea, redness, flushing, enlarged pores. We have lots of benefits when we use the Rosatrol protocol for our patients. And there's also no limit to the amount of treatments that you can do. So I have some patients that will, they love their results and they'll ask, well, how many treatments can I do? There's no limit. You don't ever have to stop inducing collagen in your face. You don't have to stop fighting the aging process. There's a limit maybe in how frequently we would do it. So I would just say a month apart. But patients who have enjoyed their results, things get better and better as our body is healing and repairing over time. And there is no harm or foul in definitely continuing that anti-aging process. I feel like I've spoken really quickly, which I tend to do a lot. I talk fast. I do want to cover some of our special pricing. So we do obviously have a big event going on this week. And so everything is discounted pretty well. This is our regular price for the microneedling alone. So this wouldn't include any of the add-ons or the post-procedure products, but the $500 is now for a regular treatment price is discounted to $250, which is pretty fabulous. I do believe there's a limit of 2 on that. So, we might be limiting you with pricing, but definitely you can continue doing treatments outside of this special discounting. And then we also have it discounted with our PRP. So again, this treatment now is requiring a little bit more out of our office and our providers. So it's regular $600 price and it's discounted to $399. And there is, you can purchase up to 3 at this price. So I think as a package deal, that's a really fabulous opportunity. And especially if we know going in that we need more than just a pick-me-up, if we're trying to target your acne scarring, I think a package would be super ideal. And then microneedling is also paired into one of our other packages. So We talked a little bit about how it's also great for texture on the skin, fine lines and wrinkles, and where do we maybe see that more than around the mouth? It doesn't matter what our history is and whether we've smoked or not, we break down skin around the mouth. And so this package would allow us to do filler, a little bit of Dysport around the mouth to help with the muscle movement. So now we've addressed two of the aging problems, which would be volume loss and muscle related weakness of the skin. But now we can do microneedling and help with the texture of that area. And we would be treating the whole face. So you'll benefit from seeing that everywhere. We're definitely not going to just target around the mouth. When we have that device out and available, we're going to do a good job all over. I do want to mention too that we have this package together with our firming serum accelerated serum. It's a long mouthy word or term, but one of our raffle packages. And so, we're halfway to our goal with our raffles right now. We've made $2,500 and we're almost to, basically halfway to the 5,000 that we were hoping to get, which is really cool. It's going to be raising money for the Valley Fever Institute. Nobody on this call is probably unaware that Kern County has a big problem with valley fever. So help us raise our money to that goal with having the opportunity to win some amazing things. You can look on our website and see which packages. There are two of them that include microneedling, and obviously there's other great packages too. So if you've already made a purchase, you've already done your raffles, feel free to call in and purchase some more. We will be announcing the raffles on Monday. So I know every year this is a little bit tricky. You patients feel like, well, what if I win? I don't want to buy something and then have won it, and now I don't necessarily need that. Well, first of all, you will always need anti-aging. But secondly, that money that you spent, if you bought the package of microneedling, will remain as a credit on your account. If you want to apply it towards other specials, just count that as a double win. And I don't think there's anything wrong with that. Okay, so as fast as I spoke, does anybody have any questions? Did I skip too quickly over things? Please let me know.
So one of the first questions is, what are the short-term and long-term benefits of this procedure?
Okay, so short-term, we would definitely see an improvement in just the overall quality of our skin. You're going to see a dewiness and a glow of healthy skin. Healthy skin is always in. That's, one of our favorite things to say in this office. Long term, you will have sort of slowed down the aging process. You will see now, if we're treating acne scars, the improvement in that texture may take a little bit of time to appreciate. So that would be more of a long-term benefit, but the scar is not going to come back once it's healed and repaired. You could create new ones. So I would also suggest that we be on a routine and management that's going to keep acne under control, because we don't want to create new scars. And the texture is not going to come back. But I would also suggest that we do other things that are helping maintain those results. And that would be something long-term, your skin, not just doing one treatment and then never doing anything for your skin, and pardon my French, but treating it like crap. You want to keep it maintained and keep the results.
One of our next questions is about acne. So how does this particular treatment actually help remodeling the acne scars?
Great question. So the needles, let me backtrack. So what's happening with that acne scar is the tissue is being pulled down by a piece of what we would call a fibrous band or fibrous connective tissue. That connective tissue that's pulling it down and creating that depression of that scar, the needles are essentially subsizing that and releasing that tension, allowing the body to heal. And that's just one component of it. Of course, then we're microneedling over the top of that and all around it and creating those injuries to stimulate the healing and repair process all around the acne scar too.
Is microneedling only for the face, or can it be used on other parts of the body as well?
Also, good question. So definitely anywhere. Obviously, primarily, I would say we treat the face most often. Fabulous for the neck and décolleté. When we're side sleepers, we start to get lines on our chest that, it's not going to be a one treatment is going to address all of those other aging things, but it is a component that will help with all of the aging process. We've treated arms for sort of the crepey skin that we start to experience there. Stretch marks. I don't think there's any treatment in the world that's going to be the most amazing thing for stretch marks or scars, and be a one-time, totally 100% take care of it. But I think we should absolutely be trying to remodel the skin and the scarring that we achieve with those, or that we, are experiencing with stretch marks and scars as well, anywhere on the body.
Can I have microneedling while on retinol?
I would have you stop your retinol a few days prior, and then you would resume it a few days after. So yes, you just have to kind of take a short break from it. I would also suggest, if you're already well accustomed to your retinol, 3 days is fine. If you've just started it and are going through the reaction phase, that I know you want to quit your retinol anyways, but maybe give me 4 days so that the reaction phase will have stopped, and then you can resume it, a short week after the treatment.
How long should you wait between treatments?
1 month. And if you waited longer, you're not undoing your results from your first treatment by waiting longer. We just want to give the body time to heal, even though you'll feel back to normal way sooner than a month. You'll feel back to normal within a few days. We just want to allow a good healing response before we start treatment too.
Is it always recommended to do more than one to get the results you're looking for?
That is a tricky question, and that would require an in-person consultation. It really does depend on the results that you're looking for. So again, acne scarring, I would absolutely suggest that you're going to want to plan for more than one treatment. I would suggest 3 to 5. If I was looking at mine or Laz or Rachel's or Julie's skin, who you've seen us on camera the last couple of days, I know that one treatment for me, I would feel like I've got a fresh glow about myself that I would love. So again, and I'm not trying to treat acne scar on my skin. So that's not something I can answer without seeing any of your faces right now.
What can you expect after a treatment?
So you'll be red for the day of the treatment, little sunburn, pink, rosy, fleshy sensation that you'll be feeling like a bad sunburn as well. That can last the rest of the day. You'll likely be fine the next day, but I always tell patients to just plan for a longer downtime. And if the next day you look fabulous, that's a bonus, but plan to be off for the next 2 days, and just so that if you are that person who has redness extending into the following day, you're not disappointed that now you were planning to go to a big event or something. In fact, if we're trying to get results for an event, I would do it at least 2 weeks before.
What are some of the ZO products that are recommended post-procedure?
The growth factor serum is a fabulous treatment afterwards. It feels silky on the skin. It glides really nicely. The firming serum, I would almost even better suggest if we're not doing the accelerated, concentrated version of it. Then if you already have firming serum at home, that one's one that you can apply that helps to drive the product deep into the skin. We also have hydrating cream. So we have a couple of different options, kind of working with maybe what you already have at home from your ZO protocol versus things that we can add on. The accelerated serums would be a 1-week protocol. You would use that serum twice a day, immediately post-procedure, and then again that night and beginning the next day for 1 week. And even though you would have resumed to the rest of your skincare, you would still use the rest of that bottle that concentrated version comes in for an entire week.
So one patient's asking that their main concern is wrinkles. With that being said, is microneedling better if combined with Dysport?
I also want to say that would require more of an in-person consultation, because if your muscles are moving, and those are the wrinkles that we're talking about. For example, if we've got lines in the middle of our forehead from furrowing our muscles together, microneedling's not putting Botox or Dysport into the muscle, just putting it into the skin. So you're still going to need to stop the muscle movement with your Dysport treatments. And depending on the severity of your wrinkles, I wouldn't probably suggest that microneedling alone is going to be the answer. But it is something that helps improve the process. It's an added benefit to the treatment. You get added results with that as well.
So that looks like all the questions that we have for now.
I like it. You guys keep me on your toes, or on my toes. So I will announce our winner for the giveaway. Thank you guys for tuning in and listening. Christina Ramos, looks like you are our winner for a microneedling treatment today. And our office will contact you to maybe schedule an appointment, or if you'd prefer to start with a consultation, we can absolutely do that as well.